We'll give it the elbow, yeah. How are you? You okay?
Yeah, so coming.
Yeah,
Meet Aaron, young, good-looking, fit and healthy. Quite the contrast with what he looked like just 3 years ago. During that time, he's lost over 100 kilograms. It's been an amazing achievement and he's become a role model for many others. But he openly admits that during the pandemic, it's been hard to keep the weight off.
First few weeks of COVID, I was really struggling, but being out of routine and stuff like that. But it's just about trying to find different things you can build into your daily routine, really. For me, I've been doing like your online workouts and stuff, going out for walks when I can, tidying up the house for the partner. So yeah, it's just about trying to keep busy.
The greatest enthusiast for tackling obesity to fight the virus is Boris Johnson, the heavyweight British Prime Minister who nearly died of COVID and now looks visibly slimmer. He wants everyone else to follow his example, but countless experts say it's not as easy as it might sound. Physical health is one thing, mental health something else again, and the lockdown has been incredibly stressful for so many people, with the kids at home and enormous financial worries playing on people's minds. Telling people they need to lose weight and expecting them to be ready to do it aren't necessarily the same thing at all. Indeed, some research suggests a majority of adults in Britain, as elsewhere, have put weight on during the pandemic.
And it's definitely difficult when all of the offers and the kind of the cheaper foods, if you like, are those foods which are high in fat and high in sugar. So we absolutely need to see a shift in kind of the promotion of foods to make sure that healthy foods get a good shot of those offers as well.
Just as confusing is that the same government recently announced a voucher scheme, effectively giving everyone small amounts of money to encourage them back into restaurants. Nor has the government done anything about repeated calls to take down the billboards and adverts tempting people into eating in fast food restaurants.
That alone wouldn't work by itself. It has to be complemented by all the other measures that have been proposed. But it would make a big difference just in the foods that we're seeing in our environment. And I don't know about you, but every time I see an advert for an unhealthy food, I want it. If I didn't see it, I wouldn't be influenced like that.
The biggest visible upside to people's health in recent months has been a big rise in cycling as people try to stay off public transport. But the queues outside the fast food giants tell another story. Getting the UK and other Western countries to lose weight quickly will not be easy. Laurence, Al Jazeera in southeastern England.